Hi everyone. So as a lupus patient, I've always been told to avoid the sun. So initially I was so obsessed with sun avoidance that I would use umbrellas, wide-brimmed hats, and long-sleeve tops in the middle of summer months. And as a 20-something young grad student, it did a number on my self-confidence. As many of you know, I've just gotten back from California from a family wedding and a much-needed vacation in Malibu, California. I grew up in California and left after marriage in 2003 with the birth of my older son. Prior to that, my life in California was a rough one. Diagnosed with lupus just 5 years prior, most of my memory of California is very dark and sad. As most of you know, weather in California is amazing for all 12 months of the year. And to be told to avoid the sun meant I had to give up all the recreational activities that I thoroughly enjoyed. It's been about 5 years since my last flare, and I've never felt better, and it's a record number between my flares. Keep my fingers crossed. My prognostic lupus panel that I advocate, called AVISE, tells me that my lupus is under full control, almost to a point of non-existence. So Malibu has beautiful mountains to hike and beautiful beaches to explore. So we did just that, and I have a golden tan from all the exposure to the sun. Of course, I wore a wide-brimmed hat and sunscreen to avoid premature aging on my face, but I wasn't donning a long-sleeve shirt. Rather, I felt pretty much at ease with wearing tank tops and shorts, bathing suits at the beach without the need for the umbrella. I was sensible. We were hiking early in the mornings and hanging out at the beaches late afternoons when the sun rays weren't so strong, but I felt great and I still feel great. I have to say, I've never felt so healthy in my life. But the key was in making the effort to get to this place. I was tenacious about beating this thing that threatened my livelihood and my existence. I refused to succumb to this disease and disagreed with the conventional methods that are readily prescribed for my condition. I felt a sense of deep gratitude and humbleness while hiking. So today, I live to challenge the inherent limitations that the diagnosis of disease puts on those of us who live with a chronic illness. So let's talk a little bit about sun exposure. Most of us avoid sun due to the cancer risks, premature aging, and other medical reasons. But our lifestyle today is not conducive to getting sun exposure, especially for our kids' generation, due to so much dependence on our technological devices and indoor activities. So vitamin D is synthesized when exposed to the sun from our skin. While it can be obtained from foods and supplements, vitamin D is made in our skin upon exposure to specifically UVB radiation from sunlight. And because of the increased incidence of skin cancer, there's been a huge shift in the way people expose themselves to the sun. Because the fact is, if you put sunscreen, you're not getting vitamin D synthesis. Key is always balance. So let's talk a little bit about the importance of vitamin D. It's estimated that up to 90% of Americans are vitamin D deficient. I've been told to avoid the sun, take the meds, come for a follow-up every 3 months. Never have I had any one rheumatologist over 19 years of being a lupus patient ask me about my diet, my vitamin D status, or express concern about my muscle mass. Yet, when you're not exposed to the sun, you will be in danger for a number of other conditions. Specifically, the vitamin D deficiency is what I'm talking about. Most experts now are recommending getting about 10 to 15 minutes of sunlight daily without wearing sunscreen to make that synthesis. What are some of the symptoms of vitamin D deficiency? Well, we know that there's plenty of evidence showing that people with vitamin D deficiency are at an increased risk of developing health complications, metabolic dysfunction, and various immune disorders. And according to several scientific studies, vitamin D deficiency can be linked to the following symptoms: weakness, chronic fatigue, depression, trouble sleeping, anxiety, immune system dysfunction, unexplained inflammatory symptoms. And specific conditions associated with vitamin D deficiency are osteoporosis, autoimmune conditions, cancer, mood disorders, inflammatory conditions like arthritis, diabetes, chronic pain, fibromyalgia, and autism spectrum disorders. It's especially important for me when I weigh why I'm told to avoid the sun to what happens when we're deficient in this essential vitamin, because as you can see, many of those symptoms are the same symptoms for lupus. Conventional medicine is far behind the terms of utilizing natural order as the first line of defense against treatment for all disease or symptoms. I think we complicated the situation unnecessarily, focusing on the problem as opposed to focusing on the solution. Solution is always about balance and natural order. So how do you get enough vitamin D? Well, vitamin D is available in various foods, but due to the risks with sun exposure, I would recommend that you supplement, especially if you have the above symptoms or conditions. But prior to supplementation, I highly recommend that you get your levels checked. It's not a common thing that is checked. I've seen some patients bring them in, but sometimes you have to ask. Your primary doctor will be able to do it. It's a cheap test. And once you check it, I'd like my patients to be at least at 65 nanogram per milliliter. Typical cutoff point is 35, which tends to be lower limits of normal. However, it's important to know that if you are within the normal range, even if it's in the lower limits of normal, then your doctor will likely dismiss those levels. Because it's a fat-soluble vitamin, meaning it's not easily excreted if in excess, there's a risk for toxicity, which is why most doctors shy away from providing more. There are many physicians that check those levels, but my personal rheumatologist never checked it unless I asked, and even then told me to take the minimum dose when I was significantly low. So I hope this message empowers you to not let your medical diagnoses or symptoms get in the way of you living the life you love. If you enjoyed this, please subscribe to our newsletter, YouTube channel, like us on our Facebook page, Lupus Rebel and Alkaline Wellness, and even our Instagram at Alkaline Wellness, as well as at Dr. Connie Jian. I'll see you next week.